All right. Hello, everyone. Good afternoon. We're going to get started in just another couple seconds. I want to let a few more people have some time to hop on with us today. So we'll be started shortly. Thank you. All right. Hello, everyone. Welcome again. Thank you so much for joining us. It is Monday, start of the week. I hope everyone had a nice weekend that was full of self-care because we know we all need that. My name is Amanda Martinez. I am the Training Program Manager for Mental Health America of Hawaii, and this is our Youth Mental Health in Hawaii presentation. Right? So just a little logistical information before we totally jump into the material today. This is a Zoom webinar format, so everyone's cameras as well as microphones should automatically be turned off, so don't worry too much about accidentally turning anything on. That shouldn't happen. I'll make this a little bit interactive as much as I can, at least. So sometimes I'll be asking questions of the group, and so when I do that, go ahead and use your chat box feature, which should be on your screens. If you feel like participating, of course, it's totally up to you, but I feel like it makes learning a little more fun when everyone does participate. So you can send a message to all panelists, and only myself will be able to see that message. If you send a message to all panelists and attendees in that chat box feature, then everyone else who is on the webinar today will also be able to see that as well. If you have any questions, feel free to use the Q&A feature on your screens as well. It's a little easier for me to track any questions that might come up. I'm hoping to dedicate some time at the end to answer any that any of you might have. However, if you put them in the chat, I may be able to kind of scroll back and find them, but it's just easier to use that Q&A feature. And we'll also have a couple polls that might come up. So once we get to those, they should just pop up right on your screen, and all the answers are anonymous, so don't worry about outing yourself in any way. All right, so here's a little overview of what we're going to be talking about. Very briefly, going to talk about who we are as an organization. We're going to cover a couple statistics just to get a quick snapshot of what mental health looks like for our youth here in Hawaii. We're going to cover different challenges that are present for youth seeking services or with mental health challenges. And then we're going to spend some time talking through different solutions, right? So what are those things that we can do to be able to help support our youth? Right, so Mental Health America of Hawaii has been around in the state for over 75 years. So we consider ourselves a statewide organization. Our main office is on Oahu. We also have a Maui branch, which Ms. Danielle Bergen, who's on the webinar with us today, is the head of. But we also partner with a lot of community organizations and other community partners just to be able to extend our reach as much as we can and make as many resources available as we can. Our mission is to promote mental wellness through 3 different areas: education, advocacy, and services. So historically, Mental Health America of Hawaii has been the lead of or been a member of various coalitions and task forces, really advocating for access to mental health care, access to services, and increasing mental wellness, right? Reducing stigma. The second area of our mission is education. So this is really where the bulk of my time is spent, is offering several trainings. So, like everyone else, we have been working to adapt to this new reality that the pandemic has created for us, right? So moving our trainings into a more virtual format. Some were super easy, others have been a little more work in progress. So the bolded ones right now on the screen are the ones that we have been capable of offering the past couple of months, and mental health first aid is also very recently, I should have bolded as well. We are capable of offering it. We do have limited scheduling options, but it is also one that we have been trained on to offer in a virtual format. Right? And of course, we are working on developing other seminars and trainings as well to offer to the community. So just make sure you're signed up for our mailing list, or that you're checking our website for those future opportunities that become available as they do. Now, the third area of our mission is services. So as an organization, we do not provide any direct services per se. Rather, what we do is we connect people to resources. Right? So we have a finding helpline as well as a finding help phone list. So feel free to call our office. Someone is usually here Monday through Friday about 8:30 to 4:30. We are happy to point people in the right direction, provide any information or resources that they might need. And you can also find our Finding Helpful list on our website, as well as a downloadable PDF. It's a fairly comprehensive social services directory, and the really cool thing about it is that these resources are separated by island as well, so you can really find something specific in your location. All right, so it looks like we're coming up to the first poll here. So I have the slide up here on the screen, but I'll also launch it for you as well. So this is kind of a little icebreaker for us, right? So the first poll we have is: when passing by a reflective surface, I use it to see if anyone is following me. I check myself out, because doesn't everyone? Or use it to contemplate the deeper meaning of life. I'll give everyone a couple seconds to answer these. Again, totally anonymous. Don't worry about outing yourself or your answers. We encourage honesty. All right, so looks like a majority of people have voted. So to be respectful of your time, let's see what we have. All right, so we got 18% say use it to see if anyone is following me. 75%, the majority, is check myself out, because doesn't everyone? And 7% say they use it to contemplate the deeper meaning of life. Right? I think that one is particularly appropriate as Mulan is coming out soon, right? So I always think of that time when she was looking at herself in the reflective water, right, and contemplating who she was, right, and what her purpose was. Thank you so much for participating. This is really great. For myself, I would probably pick the first one, use it to see if anyone is following me. I'm a huge true crime fan, so like podcasts, books, TV shows, documentaries, whatever it may be, I'm totally into. So I would probably use that reflective surface just to check my surroundings and see if anyone is in my personal space at all. But it really depends on the person, right? And the point with this poll really, and in a larger sense as well, is that we're certainly not trying to turn any of us into mental health professionals or even into public health professionals by any means. With this presentation or with any of the other presentations or trainings that we offer, but hopefully with some more information, a couple tips, and awareness that there's a lot of different resources that are out there, we can increase our noticing skills a little bit more, right? And ultimately, that's what we want to try to do, because when we know better, we do better. Okay, so we're going to briefly go over a couple statistics, give ourselves a little snapshot. I do want to make a note that most of the statistics that we'll be seeing in the next couple of slides really reflect pre-COVID-19, right? There's still research that is being done about the effects that the pandemic has been having so far on youth's mental health, even here in Hawaii, but also on a national level and across the world too. But the research that has been done so far, what has been made available, reflects increases in levels of depression, anxiety, and even psychosis across the board, right? So we see an overall negative impact that the pandemic has had on youth's mental health. And I think we can extrapolate that across the board as well to other age groups and various populations too. So just something to keep in mind, a lot of these statistics are pre-COVID. All right, so Mental Health America as a national organization comes out with a State of Mental Health in America report every year. So as of their 2019 report, they found that almost 12% of youth in Hawaii experienced at least one major depressive episode in the past year. And of that 12%, almost 60% of youth did not receive any mental health services, right? So they didn't receive any help for that. And that's pretty reflective, I think, of a lot of help-seeking behaviors, not only for our communities here in Hawaii, but across the nation as well, right? There's often a delay in seeking treatment. Right, so our first kind of group chat question here is, how long do you think that delay in seeking treatment is, right? How long do you think it takes someone to seek or receive treatment for a mental health problem on average? So from the time point where they start exhibiting or experiencing signs or symptoms of a mental health problem to the time point where they seek help for that problem or receive help, on average, how long do you think that is? And go ahead and drop your answers in the chat box. I see 6 months. I see 1 year. I see a year with a question mark, right? A year and a half. Another 6 months. Right, so it's looking like our guessing range is between 6 months to a year, right? So nationally, it takes someone an average of 10 years from the emergence of a mental health problem to seek or receive treatment for that problem. Right? 10 years is the national average, and that's the median, right? So 50% of cases will receive help below that 10-year mark, but 50% of cases will also receive help after that 10-year mark. Right? So that statistic was a little shocking to me when I first heard it, because 10 years is a long time, right? And I think that's especially concerning for our youth, because so much happens in 10 years, even in that age group or age range, right? And by youth, I'm really using that term in a general sense. So a lot of these statistics and the tips that we're providing, let's say for the sake of this presentation, it'll be around adolescent age all the way through young adulthood. So maybe like 13-ish to about 24, right? In a general sense, right? I see a comment that's scary. Yeah, absolutely. It's absolutely concerning, right? If we think of possibly a 13 or 14-year-old start exhibiting signs and symptoms of anxiety or depression, right? Two of the most common mental health problems that we see. And on average, it's 10 years before they get any help for that. That's a long time, right? And a lot's happening. There's a lot of changes and transitions that are happening. They're changing physically, mentally, emotionally, socially, right? Meeting new friends, trying to make those connections, trying to find their way in the world, trying to find their purpose, their identity. Maybe they're moving through high school, maybe they're graduating from high school, looking at different colleges, all while trying to keep in mind this new kind of world that we're living in, right? That it's all kind of in a virtual form, doesn't really look the way that it used to. So I think it's just so important that we are having these conversations, even with our youth, that we are talking about mental health and we are stressing the importance that, you know, it's okay to be feeling what you're feeling. It's not a problem to have a problem, but it is a problem if we cannot talk about it, right? If it's something that we sweep under the rug or keep behind closed doors or just keep it in the family, the more conversations, open and honest conversations that we are having about mental health, the more we can create that safe and supportive environment for people to open up, right? Because it's not the easiest thing in the world to open up, especially if it's something that you are struggling with. Okay, so Mental Health America is a national organization as well, offers several free online screening tools. I'll give you that information at the end of this presentation. Excuse me, but this is some data that came from specifically their youth test. So they found that there was a disproportionate amount of youth still experiencing depression and anxiety, right? Two of the most common mental health disorders. So 14,251 took that youth screen the month of June 2020. So just a couple months ago, and 76% screened at risk for emotional, attentional, or behavioral difficulties, right? So 76%, that's a moderate chunk, right? That's a huge chunk, more than half. So mental health issues continue to be more pronounced in young people, right? And these percentage increases were directly mirrored by decreases in choosing COVID-19 as the only reason behind, you know, their feelings of depression or anxiety, right? Or the results of their screening, right? So it's not just the pandemic that is contributing to these increased statistics that we are seeing, right? So that, you know, suggests that there's broader societal issues at play, and we can see that, right? with the political divide of our country today, with the social unrest that we see happening across the country. There's just so much happening in our state of Hawaii, across the country, and even across the world, right? So there's a lot of different reasons that are suggested to be behind these increases. But of course, in a general sense, we are absolutely seeing increases. Okay, so this is a chart from the Department of Health, their Injury Prevention and Control section, EMS and Injury Prevention Systems branch. So this is a chart of fatal injuries or fatal causes in the state of Hawaii from the years 2015 to 2019. And what I wanted to point out here is one of the top causes of fatal injuries in Hawaii for our youth is suicide. So the next couple statistics will represent suicidality. Right? Now, when we're looking at a chart like this, we see that it's kind of one of the top fatal causes of injuries across many age groups. One important thing I want to know whenever I look at a chart like this, of course it's concerning and maybe a little alarming to some of us, but I always try to find a little nugget of hope. Right, something to grasp onto, something to look forward to, especially when I see charts, graphs, or statistics such as these, right, that might be a little scary. So what I want to pass on to you is a little message of hope, and that let's think of all of the different prevention efforts that have gone into preventing motor vehicle accidents, right, those yellow boxes. Across the decades, we have seen decreases in the amounts of motor vehicle accident fatalities, right? And that's really because there's been so much prevention efforts that have been put into that, right? Safer vehicles, traffic laws, seatbelt laws, right? If we put those same kinds of efforts into preventing suicide, I really think we would also see a difference in these numbers as well, right? So there are things that we can do, and we will be covering what those things are in a couple slides as well. Right, so these numbers come from the Youth Risk Behavior Survey. Right, so this is a survey that goes out to schools every couple of years. So this chart or this slide reflects from the year 2017. I believe the year 2019 is just recently been made available. I think I saw a little glimpse of it, but for this slide, for the sake at least, this is 2017 data. So it found that about 24% of middle school students and about 16% of high school students reported having suicidal thoughts. About 16% of middle school students and 15% of high school students reported making a suicide plan. 12% of middle school students and 10% of high school students self-reported having made a previous attempt before, right? So, you know, it is true that suicidal thoughts may be common among youth here in Hawaii, but what is encouraging is that we see these numbers decreasing as we kind of move along this spectrum, right? As we get a little more serious. So not everyone who thinks about suicide, not everyone who makes a suicide plan, and not even everyone who makes a suicide attempt actually dies by suicide. So what that tells us is that there's a lot of opportunity there. There's a lot of opportunity for prevention to happen, right? So again, you're looking for those nuggets of hope, right? Even in these bleaker statistics. Right now, something I also want to point out is the amount of self-reported youth support in Hawaii, right? So almost 84% of middle school students, almost 82% of high school students felt that they had an adult or teacher that they could talk to at home or at school about things that were important to them, right? And youth are fairly resilient, right? And resiliency increases with the support from supportive adults and supportive positive peers in their youth life. So the Kauai longitudinal study was a study that was done a number of years ago here in Hawaii, and what they were looking for was those factors that increased a person's resiliency. So they followed a group of youth over a number of years, and what they found was having one meaningful adult, one meaningful peer, and one meaningful activity. Having those three things in a youth's life greatly increased their resiliency over a 30-year study period. So that just goes to show how important it is that we are supporting our youth, right? And another one on support, of course, right? Almost 70% of middle school students, about 60% of high school students felt that they had at least one teacher or adult that in school that they could talk to if they have a problem, right? So I know that schools are looking at a little different right now, right? There's still a learning curve happening there. There's still adjustments being made, changes being made almost on a daily or weekly basis even. But there's still people who care. You know, there are still teachers out there who want to support their students, right? There are still adults out there who want to support the youth that they work with professionally or even have in their personal life. So if we can just continue to foster those supports and bolster those connections in whatever way we can, you know, keeping in mind everything that's happening right now and doing so in a safe way, we can help increase the resiliency of our youth. Okay, so let's briefly, you know, just cover different challenges, right, that are related to a variety of topics, which we'll cover in the next couple of slides. So basically, you know, what is it that we know or even don't know about mental health problems? What are some of the missing pieces, or maybe what are those pieces that no longer fit? Okay, so we know that that mental health problems are common, right? And they also often develop during adolescence, right? So actually half of all mental disorders begin by the age of 14 and 3/4 begin by the age of 24, right? And I totally should have told you this in the beginning of today, but all of these slides will be made available to you. We are also recording it, so we'll make that recording available to you as well. So I apologize to anyone who's been scrambling to take down all of these notes. I'll make that available to all of you, so do not worry, okay? We also see that youth and young adults are still developing, of course, right? Physically, mentally, emotionally, right? And socially, right? So they may be experiencing symptoms of mental health problems differently than adults do, or they may not even know what that they're experiencing is not necessarily part of that typical adolescent development, right? They may feel, and that may create feelings of loneliness, right? Youth and young, and I also think adults, right, may not be well informed. Mental health is one of those topics that is not the most comfortable to talk about, especially when it comes to ourselves or family members or people that we care about, right? And because of that, there's a lot of stigma, right? But there's a ton of really great, reliable information out there, and I encourage you to find that reliable information and reputable information and share it, you know, with as many people as you can, because the more we can increase our awareness and increase our knowledge, the better we can do, right? There are some challenges related to access as well. So a lack of insurance, right? We've heard recently how so many people have been losing their jobs, right? And in turn, probably losing their health insurance, or maybe their health insurance coverage isn't what it used to be, right? Or there may be, you know, not a broad, the same type of services offered for every plan, right? We also see a shortfall in psychiatrists and a really overall undersized mental health workforce, especially on our neighbor islands. We see a disconnect between primary care systems and behavioral healthcare systems, right? So oftentimes people think of physical health and mental health as something that's being separate, right? When actually they're very connected. The brain is an organ as well, right? Mental health problems, mental illnesses are just problems and illnesses with the brain, right? So we should be treating the overall person, right? And you may even see this reflected if you experience some anxiety, right? Or whenever you feel stressed out or anxious, sometimes you'll get a stomach ache or a headache, right? Maybe you have trouble sleeping. So we see kind of those mental health problems presented in a physical way as well. So there's absolutely a connection between physical and mental health. And so we should be pushing our efforts in the same direction. And then finances, of course, kind of related to that lack of insurance coverage is insufficient finances, maybe to cover costs of copays or inpatient hospital stays, or maybe the providers don't take those insurances, right? People losing their jobs, maybe there's an overall lack of finances, right? So a lot of barriers that also are related to access. Now, one of the biggest challenges, at least in my opinion, I think, is the stigma that's associated with mental health, right? People sometimes see mental health problems as something that's a moral or character flaw, right? Something is just inherently wrong with that person, right? And why can't they just snap out of it? Or why can't they crawl out of what it is that they're going through, right? It's their fault. This is not me or my family. You know, I don't experience any mental health problems. No one in my family does. None of my friends do. It's not in my immediate purview vicinity, right? So it's not real, right? I don't have any kind of connection to that. When in reality, what we know is that about 1 in 5 Americans will experience a mental health problem at some point in their lifetime. Okay, so we know that mental health problems are common. Okay? Some people see asking for help or seeking help as being a sign of weakness. I think the total opposite of that is true. If someone is able to recognize that they are struggling and reach out for help, or even be open to accepting help from a loved one or a friend, that's a huge sign of strength. That's not an easy thing to do, right? So I would say that seeking help, asking for help, being open to accepting help is a huge sign of strength, not weakness. And then, of course, there's a media portrayal that we see with mental health that greatly increases stigma. We often see negative things reflected in the news media and television shows and in movies as well. Okay. So a little activity here. In the chat box, I want you to just really quickly, I'll only give you a couple seconds to do this. Put any kind of words or phrases that you have heard to describe someone who experiences mental health problems, right? What have you seen in movies, television, or even in the news? What are those words or phrases? Or maybe even just in the community. I see crazy, attention seeker, psycho, unstable, cuckoo. Couple more: crazy, stupid, slow, lazy, mental, unwell. Yeah, all of these, addict, issues. Yes, all of these, right? We have all heard of these. Dumb, weak, right? Now, just kind of reflecting on everything that's happening, or all of these words that I just named off or that you're seeing in the chat, are these negative or positive words? I think it's pretty obvious that a lot of these words and phrases are more negative, right? And that's stigma, right? So when I do this activity in person, which is why you'll see those sticky notes there, right? Is we take all of those words and phrases, I have everyone kind of write them down on individual sticky notes, and I ask for a volunteer or my co-trainer to stand in the front of the room, and we put all of those sticky notes on that person, right? And the point of it is just to show a visual representation of what stigma is, right? That we're associating all of these negative terminology, all of these negative phrases to a human being, right? And human beings are more than that. They are not just their diagnosis. A person is not just their diagnosis or one part of their identity. They're a whole facet. There are whole many facets of identities, right? And there are more to that human being. So we should be looking at that person as a human being instead of just these negative words or phrases that we may be hearing, right? Because words are powerful and language is very powerful. There are also, thank you also, by the way, for participating in that little activity, putting your answers in the chat box. I appreciate it. So there are also COVID-19 related specific challenges, right? So a disruption in education schedules and routines, right? So there was a time where a good amount of students just weren't in school anymore, right? And now that we've kind of shifted into this, or we're trying to shift into this virtual format, they're not seeing their friends on a regular basis, right? In the same kind of way that they used to, being able to sit with them in class or see them in the hallway or have lunch together. Missing milestones as well. I mean, it wasn't too long ago that it was graduation season, right? So a lot of ceremonies were canceled. We did see different areas of the community being a little innovative and doing kind of drive-by graduation ceremonies or even virtual ones, right? Which was good and hopeful to see, but it's still a disruption in those major milestones, right? Sports and school activities also are canceled or like very, very different, right? So a huge disruption in all of those areas that our youth are usually used to experiencing. Physical distancing as well. And please notice that I put the term physical distancing as opposed to social distancing because yes, keeping safety guidelines in mind, we should be practicing physical distancing, right, to the best of our ability. but we shouldn't be isolating ourselves in any way or cutting off any of our social ties by any means, right? Those are the things we actually should be focusing on and bolstering as well. Right? We see inequalities that were present before becoming even more pronounced now. Right? So for example, schools may be no longer a source of regular meals, right, for their students. And some students maybe really relied on that, right, to have a regular meal every day. Some students may not have access to electronics, to laptops, to computers, to Wi-Fi, or have a hotspot, right, to be able to participate in distance learning. So the problems that or the inequalities that we were already seeing before and not really talking about are becoming even more pronounced now, right? And of course, we've been talking about how there's an uptick in those mental health challenges as well, right? So these are just a few examples of COVID-19 related challenges, but we are already seeing that impact, right? That negative impact across the board for our youth. Okay, so how can we help? Right? My background is in public health. One of the questions that we often ask in public health is, so what? Right? Now that we have done all of this research, we've established that there is a need in our communities. What are we going to do about it? Or what can we do about it? Okay, so this is something that I saw a lot in grad school. This is the social ecological model. Right? Now, the good news for you is you don't have to completely learn this or even read everything that's on the slide. I'll absolutely summarize this for you. So our main focus here at Mental Health America of Hawaii is a public health approach on prevention. Right? So the social ecological model is a theory that states for any prevention effort to be effective, it needs to happen on multiple levels, right? So what are we doing on an individual level? What are we doing for ourselves to take care of our mental health? What are we doing on an interpersonal level, right? How are we reaching out to our family, our friends, and our loved ones? What are our social connections? What are we doing on an organizational level? What are our schools doing to promote mental wellness? What are our workplaces doing to promote mental wellness, right? On a community level as well, what are the relationships amongst those organizations, right? Or members of the community to promote mental wellness? And then ultimately what's happening on a societal level? What kind of policies are in place or not in place? What are those cultural aspects that inform our decisions or how we approach or look at mental health? And what are those social norms as well? Right, so in order for any prevention effort to be effective and long lasting, it needs to be happening on all of these levels, right, to the best of our ability. So many of those challenges that we just talked about can be considered risk factors, right? So those things that put people at a higher risk for developing a mental health problem or mental health challenge. And in a lot of presentations, people really like to focus on what those risk factors are, learning those risk factors. But we should also be thinking about and identifying those protective factors as well, which is why I also included those support statistics too, right? There are a lot of protective factors out there, actually more so than there are risk factors, that we can use to help combat those, right? That we can use to increase resiliency for our youth and even for ourselves as well. All right, so the first kind of solution or a tool that we have is to talk about it. Right? It's okay to talk about mental health. It's important that we are having conversations about mental health, that we are creating those spaces necessary to have those conversations, right? But we should also be mindful in how we are talking about mental health too, right? So I'll provide an example for specifically using person-first language, kind of in relation to that stigma activity that we did, right? So what do I mean by person-first language, right? Here's a little chart that kind of lays it out for all of us. So maybe instead of using those terms like insane, crazy, psycho, mental, lazy, dumb, weird, all the things that we were naming in the chat box during that activity, we put the person first, right? So it's a person with an emotional or behavioral disability, a person experiencing a mental health challenge, right? A person living with bipolar disorder, a person struggling with alcoholism, right? Really what we're trying to do is put the person first, right? Because they are still a human being and we should be respectful of that and acknowledge that even in our language, right? Now, this you know, I provided you a chart and I just kind of summarized it for you and gave you an example, but this is not an easy thing to do. Right? This is not something that happens overnight. The way that we have been talking about mental health and people who experience mental health problems is so ingrained in our society today. But on an individual level, we can at least start with ourselves. We can at least be a little more cognizant and think about the words and phrases that we are using when we are having these discussions about mental health. Right, next we have support each other. Right, so check in with the people in our households that we are practicing physical distancing alongside. Check in with our friends or with our loved ones who we are practicing physical distancing with, right? And luckily we live in a world today where technology allows us to do that. We can send texts, we can make phone calls. We have social media, there's video chat features, right? And even without the access of technology, you can send a postcard, you can write a letter and send it through the mail. You can take a walk outside in your neighborhood, you know, keeping a physical distance and wearing a mask, but you can wave to a neighbor, right? You maybe yell across the street and ask how they're doing, right? It's just checking in, right? Being there to support, but also just as importantly, that we are checking in with ourselves, right? Especially if we are that kind of helping type of person that we spend a lot of our time giving. We want to be there for other people, okay? We want to make sure that we have the mental and emotional capacity to be there for someone else. Are we even the right person to check in with that individual? So things to keep in mind even for ourselves, right? Helping other people shouldn't harm us in any way. So we should also, of course, be checking in with ourselves. Listen actively and without judgments, right? So, you know, listening seems like the easiest thing in the world to do, right? But what we're talking about here is active listening, right? And reserving our judgments to any kind of answers we may be hearing, right? Or discussions that may come up. And that's not an easy thing to do, right? So listening, what we mean by that is listening not only with our ears, right? So listening and really hearing what it is that someone is trying to say or not trying to say, but it's also listening with our eyes, right? So being on the lookout for changes in behavior. If someone is acting a little differently, if they seem a little more reserved or withdrawn. And it's also listening with our hearts and with our stomachs. You know, I know it's not a very scientific thing for me to say, but if something that someone says or something that someone does gives you a bad feeling in your stomach or doesn't just quite sit right with you, listen to that. You know, it might be there for a reason. So it's okay to ask questions and find out more information, right? Just know that you're coming from a place of caring, right? That you care about that individual, and use those I statements. You know, I care about you. I have noticed that you've been acting a little different recently. Is there any way I can help? Would you like to talk about it? What's been going on, right? So digging a little deeper and finding out some more information, but also asking those tough questions. And by that, I mean, if anyone you are concerned about you think is struggling with suicidality, that they are having thoughts of suicide, or they're behaving in concerning ways, it's okay to ask those direct questions. In fact, it's encouraged to ask those direct questions, right? It's not the easiest question in the world to ask. So if you feel unprepared in asking that question, especially if it's a loved one or someone that you care about, there's a ton of resources out there that will help you to do that. We'll be providing several different crisis lines and make those available to you. But it's important that we are finding out as much information as we can and even asking those quote unquote tough questions. Right? And then of course, always encouraging help-seeking behaviors, right? Continuously sending the message that there's a lot of help out there. There's a lot of resources. There's a lot of people out there who care and they know what to do, or they have ideas, right? Recovery looks differently for everyone. That journey to help, seeking help and receiving help looks differently for every individual, but there's a lot of different routes out there. Right? So getting help does work. It is effective. So let's go find that help together, right? I'll be alongside you while we go look for these different resources. Okay. So this is a campaign that was done by the Foundation for Suicide Prevention and the JED Foundation called Seize the Awkward. Unfortunately, we don't have time to be able to show this video, unfortunately, but it's a really great video. I'll provide that link to you. after today as well. And this is just one example of a campaign that was done to just be able to get some ideas on how to start the conversation. How do I even bring it up, right? So it's a pretty entertaining video. I think very applicable to different life situations as well. So I really encourage you to watch this video when you have the chance to. Okay, another way is to be involved, right? Educate ourselves. Every single one of you on this webinar today is already doing that by being present, by participating, by being open to learning a little bit more about the status of youth mental health in Hawaii, about the different challenges that are there, and also about the different things that we can do to help support our youth. Okay? And I think a lot of these tips as well can also be used to help support adults too, right? Across the board in an overall general sense. Okay? We can work to spread awareness. So by having those conversations, by sharing reputable and informative things on social media, right? By looking up different community events that are happening, even in a virtual setting. We are raising awareness, right? Kind of shining a light on mental health. And I think one of the better things to come out of this pandemic is that there has been a lot more attention being put on the importance of mental health, right? That we're all kind of going through this really, really bizarre time together, and that's absolutely affecting us in a lot of different ways. So it's okay that, our emotions are fluctuating throughout the week or even throughout the day or throughout the month, right? That everything is so uncertain in the future. It's okay to struggle with that a little bit, right? But just know that we're all, going through this together. And there's still a lot of really great organizations and resources out there that want to help. Okay? And then, of course, you can follow our own advocacy and training efforts by signing up for our mailing list or checking our website too. And then lastly, what we have is to take care of yourself. I cannot stress this enough. Self-care, right? You cannot pour into others when you yourself are empty, right? So we should be taking care of ourselves, taking care of our mental health, so we can help to take care of others. And this is hard work, checking in with our friends and our loved ones, trying to support others while also trying to support ourselves. So just thank you for doing it, Remember, self-care is not selfish, and we should be prioritizing our self-care time, even if that's only 5 minutes out of our day. If we can work that into our routines every single day, taking 5 minutes, whatever that self-care act may be, right? And you can join one of our other, or any of our other trainings that really unpack different ways that we can focus on self-care and give us action steps or ideas or tips or tools. Pick one that works for you, right? I've heard this referred to by the wonderful Dr. Mistisa Goss, who is our program director. She said in one of our trainings to think of self-care like a bank investment, right? Even if you don't think you need it right now, what we're doing is we are investing in ourselves and investing in our self-care so that we may pull from it at a later time when we do need it, or that we may pull from it when someone else needs it from us, right? Because if you've ever been in that kind of situation where you need to be there emotionally for another person, that's draining even on ourselves, right? So invest in your self-care. Think of it like a bank investment, right? That you're kind of putting in that work now, even when you feel like you don't necessarily need it, so you can pull from it in the future. Okay, so a couple different resources that we'll cover for us today. Again, I'll make all of these resources available to you, right? So we have the Hawaii Cares line, right? So this is actually formerly the crisis line of Hawaii. It's still the same numbers for both Oahu as well as the neighbor islands, still 24/7, still free to call. You will still be connected to a live person, right? So really what's new, so ultimately the Hawaii Cares line is the state's new kind of multiple entry points and coordination center for behavioral health services, right? So mental health services, substance use services, as well as crisis intervention services, right? So previously the Hawaii Crisis Line was solely crisis intervention services, but now it's kind of expanded into several other areas as well. So just keep in mind, another available resource that has expanded, but they also do provide crisis intervention services as needed. And we also have the National Suicide Prevention Lifeline, right? Again, 24/7, anyone can call these numbers. So if you ever find yourself in a situation where you don't know what to do, you don't know what to say, or you yourself need help and you can't really reach out to anyone right away, call these hotlines. You know, that's what they're there for. All of these operators and volunteers are trained to help talk you through it. If talking on the phone or making phone calls is not your thing or something that you are super comfortable with, I'm totally guilty of that, okay? That's okay. There's also a crisis text line. Okay? You can send a text to 741-741 and someone will always text you back wanting to help. Okay? Now, the crisis text line is a national service, but if you text Aloha to 741-741, then the person on the other end will know that you were coming from Hawaii, right? So they're going to be already looking for different resources and information to be able to connect you with in your area. There's also the Trevor Helpline. So this is a crisis line specifically for LGBTQ plus youth. So if you have a youth in your life who may identify as lesbian, gay, bisexual, transgender, queer, or is not sure, or one of the many other identities that are out there, or even for those who choose not to identify in any way, there's still help and resources. Okay? And they've got a ton of other ones on their website as well, thetrevorproject.org. Mental Health America of Hawaii created a free suicide prevention app. Right now it is free to download on the App Store. So for Apple products, we are still working on that update for Google Play. So unfortunately right now it's not available for us Android users. But if you have an iPhone or an Apple device and you're looking for a tool to have on your phone or device to put towards suicide prevention, this is a really great one. It's got a screening tool on there. It's got connections to all of those different crisis lines that I just went over with you, some general information about suicide prevention, and also a link directly to our Finding Help Services directory. Okay. Now we also have COVID Coach. Okay? So this is something that was created for everyone to be able to support self-care and really overall mental health during this pandemic. So very COVID pandemic specific related app and resource, right? So what it does is it provides education about coping during a pandemic. It provides tools for self-care and to improve our emotional well-being. There's even trackers to check your mood every day and measure your growth towards personal goals. And it also gives you graphs, which are always fun to visualize that progress over time, right? And so free to download as well. I was mentioning earlier that Mental Health America offers several free online screening tools. So one of the quickest and easiest ways to tell if you may be experiencing a mental health condition is to take a free online screen. Right? There are about 9 different screening tools for mental health conditions, which can be accessed through our website at the bottom there, mentalhealthhawaii.org. So specifically, there's that youth test, but there's also a lot of other different tests as well. Right? Now, with these screenings, remember I mentioned before that we are not trying to make ourselves mental health professionals in any way in order to diagnose ourselves or anyone else in our life. Unless you are a mental health professional on the call with us, then please by all means do, okay? But specifically with these screenings, you know, we're not trying to diagnose ourselves, like I said, right? Or the people that we have in our lives, personally or professionally. Rather, what we would want to think of these online screenings and the results of those is that it may be just a good starting point in finding out some more information, right? Or maybe we can take those results that we get to our doctors, to our therapists, or to a mental health professional, so they can help us kind of interpret them a little easier, right? And maybe work through whatever it is that we may be struggling with. We are on social media as well, right? So on Facebook, Mental Health America of Hawaii, we have several, 3 different groups that we operate, and you're able to join. One of them is a book club. So we make monthly book recommendations, post different book reviews, different quotes that are taken from books as well. So if you are into reading, I encourage you to join that Facebook group. We also have a Busy Bees for our keiki, right? So we try to post different activities, fun videos, just uplifting things for our children, right, to be able to participate in. And a lot of the activities are things that can be done, you know, that aren't super expensive to do or that you don't need a ton of materials to be able to accomplish, right? And we also have a Maui Facebook group page, right? So if you are on Maui or in Maui County, I encourage you to join that Facebook page. There's a lot of really Maui specific resources and information that is dropped into there as well. If you're on Instagram, we are as well. Live Now, right, is our kind of our self-care page, where we post different tips and tools about self-care, you know, why that's important, and maybe different things that you can try, right? Maybe it's something you haven't heard of or haven't tried yet. So, hey, let's invest in ourselves and invest in our self-care and maybe do that. Right? We also have a general Instagram now, which I don't have on the slide here, but I'll make that handle available to you as well. But, you know, if you're on social media, feel free to follow us, check in with us, interact with us. We are always happy to do that with you. So that's really what I have for you today. We're about 10 minutes left in the hour. So I'll, at this time, open it up to any questions that people may have. I'll briefly scan through the chat box here. Feel free to use your Q&A chat box function. If you are anything like me, and after you learn something new, or get, you know, like a burst of information, and it takes some time to be able to process that, so those questions or comments may come at a later time, great, right? I'm still here. My contact information, my email is at the bottom there. That's the easiest way to reach me. I'm happy to answer any questions you might have after today, later on today, next week, next month, or point you in the right direction, or provide any more information or resources that you might need. So let me really quickly through the chat here. Okay, I see one that said 76% of students felt depressed or anxious. Is this right? So correct me if I am wrong, but I believe you are referring to this slide here. So Mental Health America's national results from their screening tool, depression and anxiety. So that one, let me get here and be able to answer your question accurately. It was 76% of youth who took this specific screen screened at risk for emotional, attentional, or behavioral difficulties, right? So that absolutely could include depression and anxiety, but could also include things like psychosis, right? Or substance use disorders as well. So that 76% is kind of on a broader sense, not specifically only depression and anxiety. It's just depression and anxiety are two of the most common mental health problems that we often see and hear of. So a lot of times that data is what's reflected. Right? How would youth be able to access services that they may need if parents or guardians may cause obstacles? That's such a good question. Thank you for answering that. That's definitely tricky, right? That's definitely hard. It's a dance, right? It's a journey in and of itself. There's different options that are available depending on the age of the youth. So there was a law that was recently passed that allows for youth ages 14 and up to be able to seek their own behavioral health services covered by insurance and not have to get permission from their parents, right? So, you know, if a youth is 14 or above and they want to seek treatment or seek help in any kind of way, but they're getting pushback from their parents or guardians, there's a little workaround for that. And then, you know, beyond that, it's really hard. You know, there's a lot of different reasons and factors that come into play as to why someone may be resistant to talking about something like this, especially if it comes to their children, right? There may be cultural factors involved that we need to be aware of. So, you know, it's providing information as much as we can, but also not forcing help in any way. We cannot force anyone to seek help if they do not want to. But we can make ourselves available. You know, we can still provide information to our youth. We can still get information about resources to our youth, and hopefully they themselves will be able to reach out. But it's definitely a tricky road, right, to navigate. You see, I'm curious to hear how schools are handling mental health cases with their students due to distance learning, if you have any insight or heard anything about that. I actually have not heard too much like specific anecdotes or things that schools are doing. I do know that There have been several like professional development events and conferences that happen. The social behavioral health counselors and administration for the school districts as well, I know, are working very hard to be able to support our youth in the school setting as well, but I'm not sure if I have a really specific answer to that one, except that there are efforts being made, right? We can hope at least. Is there any ongoing data collection on youth mental health in Hawaii that you know of? So that also is a good question. I would want to say yes, there is. However, I could not tell you what that is or who is doing that, right? We are also, Mental Health America of Hawaii, are looking to do our own kind of data collection, hopefully in the near future, to be able to get kind of a snapshot of that. So yes, there's ongoing data collection happening. Whether that is Hawaii specific and when that is going to be made available, I'm not entirely sure. Will the slides be emailed to us? Yes, absolutely, along with a link to the recording of this presentation as well. If a youth that expresses learning barriers and needs to be assessed, for example, IEP or post-secondary reasonable accommodations, is there a direct resource we can refer them to, or would they need to go through their primary care provider? That is a really great question. I'm not sure if I'm qualified to answer that. Let me copy down this question. I will do some more research and I can get back to you on that one, right? Because I'm not sure. My guess would be yes, to always go through, you know, the professional route. But I'm not sure what that exactly looks like. I'm sorry, I can't answer that totally fully there. Is it true that if the youth is over 14, they can now seek help without parental permission? Yeah, I think I just answered that one. There is a law, right, that allows youth 14 and up to be able to seek mental health services without their parents' permission. The tricky part with it is trying to find mental health providers who are accepting of patients, who work with and see youth, and who are aware of this law and know the process to go through the insurance without alerting their parents or guardians, right? But it is an option and the opportunity is there, right? Okay. Let's see. Okay. Do you know how much of an increase or uptick youth's mental health issues are experiencing during COVID compared to before COVID? I've been to many trainings and every I have heard is that there is an uptick, but just wondering how much. I work in a middle school here in Hawaii, and as a behavioral health specialist can share that all students that have counseling at school and can share that all the students that have counseling at school, we have been making all attempts to continue to work with them in person if they are at school, since some students are still attending school, and virtually for all other students. For the person who asked that previous question, thank you so much. And I love when things like this happen, when you connect with each other, because beyond myself and beyond the resources that, you know, or information that we saw in this presentation, you all can make connections with yourselves as well, right? Again, tons of information and resources out there. I think this is kind of related for the question part of your comment to similarly that data collection specifically for youth mental health in Hawaii. And I think it's still kind of in progress, at least as far as I have been able to look at research or look up to my own individual capacity. I haven't found like specific increases beyond what I've been able to share with this presentation. Just that we do see a negative impact on people's mental health, right? Remember, at the same time, by providing focusing on protective factors, by providing information, resources, ways to reach out, help each other, by bolstering that sense of community, we're able to increase resiliency, right? And kind of combat that negative impact a little bit, or hopefully a lot of it. If we wanted to provide DOE students activities to support their mental health during this time, can you provide us resources on ideas, best practices, and activities? Yes, absolutely. We have a few different trainings that are very specific to self-care and coping strategies. We have a self-care for youth, which is a self-care presentation for high school ages, we like to say, or even young adults, where we really dive into and explore different ways that we can practice self-care, whether that's physical activity, eating well, getting enough sleep, maybe doing fun activities, or finding meaningful activities, right, to extend our help and services in any way. There's definitely trainings even within our own wheelhouse. We also have a training very similar to that for adults, and also another training that provides different ideas for coping strategies as well. And there's a ton of resources out there, right? Different leading national organizations that provide really cool self-care ideas specific for students and for youth, and that they're doable, right? They're not like huge life-changing ones or things that require a huge amount of resources. A lot of the times those things with self-care is things that are very there, present, obvious, things we already know about. Sometimes we just need a little help in reminding ourselves that there are things that we can do for a couple minutes, for a day, for a couple hours, anytime we need them, anytime or anywhere we are, no matter how often, right? So it's just kind of identifying what those self-care activities are, and exploring even new ones as well. So yes, definitely tons of activities out there. An amazing resource. Oh, so contribution in our chat box. The website Plant Love Grow, I believe is the website. And if we click on free tools, then we can find many mental health issues and worksheets for each area, right? So another resource, Plant Love Grow. Right? It sounds like it's a website that you're able to look up different activities as well, right? Okay. I love all of these questions that have been coming up. This is actually the most questions I've ever gotten for any session. And I know we're a minute over past the hour. I thank you so much for sticking on with me. Again, if any questions come up after this, please feel free to let me know. I'm happy to answer those. I'll make this recording and the slides available to you after today, hopefully sometime this week, after everything is processed. But I just want to finish off with thank you so much for being here, being present, for participating, and being open to learn how we can help support the youth in our lives. Have a great rest of your Monday. Please have a good rest of your week and get that self-care in. Make sure you are investing in yourselves as well. Right? We hope to see you next time at one of our other virtual trainings. But until then, take care. Right? Thank you so much.